Hello everyone. So this week we are still kind of finishing up some of the stuff that I presented in the big 1-hour lecture from last week about kind of moral reasoning and moral theorizing and the construction of counterexamples and so on. But I did want to take a little bit of time, probably not more than 10 or 15 minutes, to talk about the kind of general principles of bioethics. You've got a reading, which is a series of excerpts from a bioethics textbook, probably the most well-known bioethics textbook in the last 20 years, by Beauchamp and Childress, called Principles of Biomedical Ethics. And they structure their whole book. We're only reading one excerpt from the book, which is like snippets of several different chapters, but they structure their whole book around 4 different principles of biomedical ethics, which I've got over here in this little this handout is up on Carmen if you wanna download it and just add it to your notes. There are 4 principles that they structure their book around: respect for autonomy, principle of non-maleficence, principle of beneficence, and principle of justice. And all of these principles are fairly basic in their abstract statement, and what I've basically done is flesh out a number of the kind of practical implications of following these different principles. What I've got over here is just a slide from the PowerPoint that lists, the 3 main moral theories. I just kind of want to show how this stuff is connected, how these things relate to one another. And I also wanted to look at the American Pharmacists Association Code of Ethics that they have, their official statement on what the kind of ethical principles that a professional pharmacist ought to follow are. So we'll start with this, do a quick rundown of this and connections between these 2 ideas, and then we're going to do the same thing with the American Pharmacists Code of Ethics. So let's look at the first principle, respect for autonomy. In the abstract, this just means you don't interfere with other people's personal choices. As much as possible, you allow people to live their lives the way that they want. So here are some practical implications for that. Tell the truth when you're dealing with other people. That might not be obvious why this is an autonomy-based consideration. We'll actually have a reading next week that gets into this connection. But the basic gist of it is that if you do not tell someone the truth, you are hindering their ability to make free choices because they are acting on incomplete or inaccurate information. And you need complete and accurate information if you're going to deliberate and make the choice that you ultimately want to make, the choice that most closely reflects your values or preferences. Another part of respecting autonomy is to respect people's privacy and protect their confidential information. You've got to obtain consent for any kind of interventions that you're going to make with patients, and when you are asked for help, provide it. Help your patients make informed decisions about the issues at hand. Now, this principle, respect for autonomy, is most closely aligned with the deontological moral tradition. So deontologists, if you're looking at like these 4 principles in general, deontologists are pretty big on autonomy and justice-related considerations, and also respect-based considerations, which could be considered a subcategory of justice-related considerations. So these 2 principles, justice and respect for autonomy, are largely non-consequentialist concerns. These are not things that are usually going to be maintained on a basis of promoting like good long-term outcomes. If you look at the rationale like for the different kinds of justice-oriented accounts that might be in play, you've got an equality-based option, distribution according to need, distribution according to like effort, which this one's not going to be as relevant in the medical context because if a person has a heart attack or some other serious medical complication, it would be difficult to figure out, like, you got 2 people in need of a heart transplant, say, how do you determine which person put more effort into deserving the heart transplant? That's a hard kind of idea to make sense of, since they were both just victims of sort of random events. So you're usually not going to see this used in a medical context very often. Another one you probably won't see used very much is to each according to their contribution. This makes sense if you're doing something like, I don't know, allocating grades on like a group project or something like that, or determining like how much a group of people should be paid for some kind of a joint job that they do. But if you're talking about, you know, how people should be provided medical care, this is again probably not going to be the standard that you use. Same goes for merit. The three then that you'll see used the most often will be trying to distribute medical resources equally, trying to prioritize those that are in the greatest need, and this last one, trying to prioritize according to economic considerations and whatever is consistent with the operation of the free market. We'll get into some issues with that when we get to the very end of the course, and we're looking at the connections between business ethics and the profession of pharmacy. But justice-oriented considerations are typically going to be based on trying to uphold a principle of equality and a principle of fairness, not going to necessarily be tied to promoting the best overall outcomes. The two principles that are more closely aligned with consequentialism are principles 2 and 3. Non-maleficence is about not inflicting harm on others, so you're promoting a good outcome by essentially minimizing pain and suffering, minimizing harm in general, and trying to make trying to avoid doing things that put your patients in a bad situation. Beneficence is a more beneficence and non-maleficence will sometimes mandate the same course of action, but beneficence goes above and beyond what non-maleficence requires. So beneficence is when you're actually providing like positive aid to people that goes beyond just preventing their pain or something like that. So this involves protecting and defending the rights of others. I mentioned like it can involve preventing harm, so there can be overlap between these two things. Preemptively removing conditions that could be harmful to other people in the future. Helping people who have disabilities or other things that make certain resources potentially inaccessible to them, rescuing people who are in potential danger, and the list goes on. The basic idea is that principle of beneficence is about providing positive benefits to people who are in need of them. And so again, it's about promoting good consequences at its core. So these four principles, two of them drawing largely on deontological tradition, two of them drawing largely on the consequentialist tradition. All of these principles are important in the context of biomedical ethics. They are also at times going to conflict with one another in some of the more challenging cases. And that means that you have to make choices about which principle takes priority in certain contexts. So you can have situations where respecting a patient's autonomy may allow them to make a choice that down the road may cause them harm. And so you may have situations where principle 1 on this list conflicts with 2 and or 3. And so you've got to make a decision which is more important, respecting patient autonomy or being more paternalistic and trying to, say, prevent harm from occurring to them now, or perhaps prevent harm from occurring to them in the future. That's a tough situation, and this is where you get some degree of professional disagreement among what ought to be done in those particular situations. You can also have situations where distributing on the basis of equality, distributing goods and services in the medical profession on the basis of equality may not necessarily be the best way to promote the general good. And so you might have considerations of beneficence that pull against a consideration of justice. There are other kinds of conflicts that are also possible. As we move along in the course, we'll see some of these conflicts in a more explicit way. I can already think of when we get to physician-assisted suicide, which is not that far away. There will be some pretty clear. There'll be a couple of clear conflicts between some of these, and when we get to those situations, there's no magic solution. There is no established hierarchy for which principle takes priority in what situation. You just have to reason it out. You just have to try to figure out in a particular situation which of these four moral considerations is most important and most critical to uphold. So no easy answers in that particular context. The other thing I wanted to do was take a look at the Code of Ethics. I'm going to leave this up because I want to point out some connections here. So this is from the APHA, and this is just their Code of Ethics page. I've got a link to this on Carmen. This is actually one of your assigned readings for the week. It is not a long reading at all. Only a couple like I think if you put this in a Word document, it's barely longer than a page. But here's their list of principles. You got 1, 2, 3, and there's like a paragraph explanation for each. Let's look at the language of a few of these. So a pharmacist respects the covenantal relationship between the patient and the pharmacist. So this is basically a professional obligation to honor the commitment between patient and pharmacist. It is a clear deontological principle, a principle of just basically keep your promises. It's not conditional on like promoting good outcomes. It's just you're a professional pharmacist. You've got to maintain this relationship no matter what, right? Even in situations where you think it might be better for the patient for some reason to violate that level of trust. Now, interestingly, of course, if you look at their explanation, they do point out that a pharmacist is like part of the reason for having this kind of this gift of trust is that you're supposed to be helping them obtain optimum benefit from their medications, be committed to their welfare, and maintain their trust. So there are a couple of outcome-based considerations that are mentioned here, but the core principle is a deontological principle. Interestingly, the second one, pharmacist promotes the good of every patient in a caring, compassionate, and confidential manner. That just sounds like an application of the principle of beneficence, and that is primarily a consequentialist principle. A pharmacist respects the autonomy and dignity of each patient. This is another deontological principle or consideration. Here, pharmacist acts with honesty and integrity in professional relationships. Well, honesty and integrity are both virtues. So here we actually have a virtue ethical consideration, right? Being a good professional pharmacist isn't just about following the rules, it's also about acting with certain virtuous traits of character, honesty and integrity being among them. A pharmacist maintains professional competence. This is actually, it's not obvious, but this is another virtue ethical consideration. Because professional competence is basically just a fancy way of saying a professional pharmacist would be someone who is well-educated, smart, has the intellectual virtues of staying up to date in the field, that kind of thing. So this is another character-based obligation, as it were. Pharmacist respects the values and abilities of colleagues and other health professionals. This is a respect-based principle. Respect-based principles are typically associated with deontology. This is basically a respect for professional disagreement. A pharmacist acknowledges that colleagues and other health professionals may differ in the beliefs and values that they apply to the care of the patient. So it's kind of a respect for potential professional disagreement among intelligent people. Pharma serves individual, community, and societal needs. Again, this sounds like an application of the principle of beneficence, which is a consequentialist principle. And the last one, pharmacist seeks justice in the distribution of health resources. Justice typically going to be associated with the deontological moral traditions. So what you see here when you break this down is that the APHA, their code of ethics is drawn from moral considerations across all three of the moral traditions that we have discussed in some form or another. And it goes to show that, as I said in the moral theory lecture, all of these moral theories are getting a piece of the puzzle correct. The challenge is to figure out how we integrate the different pieces of the moral puzzle into one cohesive view. This is the APHA's attempt to do it in the very narrow domain of professional pharmacy. They've drawn, on to varying degrees all three of the moral traditions to try to encapsulate all of the major professional responsibilities that you have if you go into this particular profession. So it's interesting to observe that kind of, the different moral values associated with these traditions actually being put into practice and actually playing a role in how the APHA has conceptualized what they view like an ideal pharmacist to be, and what they think the professional obligations of people practicing pharmacy, what they think those obligations are. So, if you were worried about our, moral theorizing just being too abstract to have any practical application, here you go. The APHA is putting them, all three of these traditions, to use in their formulation of these various principles. Now, your main task for this week is to kind of do some work with counterexamples and general moral principles. You've got a team-based learning exercise that's specifically focused on lying. That should be your main priority for this week. Again, we're still kind of finishing up some of the material that was discussed in the long lecture from last week. So I'd encourage you beyond this to revisit that lecture if there's material there that you're still not totally comfortable with. And other than that, I'll just call it here and see you in the next one.